வணக்கம், குட் மார்னிங். என் பெயர் டாக்டர் பிரபாகர். இன்னைக்கு வீடியோவில் ஜென்ரல் ஃபிசியாலஜியில் இருந்து ஒரு 5 MCQ டிஸ்கஸ் பண்ண போகிறோம். இப்போ உங்களோட யூனிவர்சிட்டி எக்ஸாமில் 20 MCQs ஈச் பேப்பரில் கேட்குறாங்க. ஃபிசியாலஜி Part-1, Part-2 ரெண்டும் சேர்த்து ஒரு 40 MCQ கொஸ்டின் கேட்குறாங்க. இப்போ சிபிஎம்இ பேட்ச்க்கு நெக்ஸ்ட்டு ஒரு எக்ஸாம் கொண்டு வர போகிறத சொல்கிறாங்க. அதுலேயும் எப்படியும் MCQ பேட்டர்ன் கட்டாயம் இருக்கும். ஃபிசியாலஜியை பொறுத்தளவு பிஜி எக்ஸாம்னாலும் சரி, நெக்ஸ்ட் எக்ஸாம்னாலும் சரி, ஒரு 20 MCQ இருக்கும். ஸோ அதுக்கு நம்ம இப்பயே கொஞ்சம் ட்ரெயின் ஆகிக்கிட்டால் நல்லது. ஏண்டா கொஞ்சம் ஒரு ப்ராக்டிஸ் பண்ணால் மட்டும்தான் அந்த MCQs வந்து ஃபுல்லாக நம்ம அட்டன் பண்ண முடியும், கிராக் பண்ண முடியும். வாங்க நம்ம MCQவை டிஸ்கஸ் பண்ண பார்க்கலாம். Question is, which substance not permitted by connexins? Connexins are component of gap junction. 6 subunits of connexins forms the connexons and 2 connexons forms the gap junction. Gap junctions otherwise called as the electrical synapse. So the diameter of the gap junction is 0.8 to 1.4 nanometers. Okay, so we will see the options. Option A, amino acids. Amino acid can pass through the connexins. So this is not the correct answer. Option B, sodium ion. Sodium ion also pass through the connexins. So it is not the correct answer. Option C, glucose. Glucose is also pass through the connexins. So this is not the correct answer. Option D, proteins. Proteins cannot pass through the gap junction. So it is not pass through the connexin. This is the correct answer. The protein not permitted by connexin. So molecular weight of the protein is 69,000. But the gap junction allow up to the 1000 Dalton molecular weight. So it is the diameter is less, up to 1.4 nanometer. So option is the protein. This is the correct answer. Question is, endothelium derived relaxing factor of nitric oxide mediated by an increase in intracellular level of option A, cyclic AMP, option B, cyclic GMP, option C, calcium, option D, endothelium. So in the options, the cyclic AMP, cyclic GMP, calcium are second messenger. So question is, endothelium derived relaxing factor of nitric oxide act via which second messenger? So second messengers are important for the cell signaling reactions. So when the hormone bind with the receptor with the help of enzymes, it produces a second messenger. It gives the signal to produce the physiological actions. So we will know the role of each cyclic second messenger, then only we can take the correct answer. So we will see the role of second messenger in the tabular column. Cyclic AMP important for the water reabsorption and metabolism and electrolyte maintenance. So vasopressin act through the V2 receptor mediated by the cyclic AMP. Epinephrine act on the beta 2 receptor is act through cyclic AMP. Secretin is act through cyclic AMP. So cyclic AMP is not the correct answer. Calcium produces the vasoconstriction and muscle contraction exocytosis. So vasopressin act on the V1 receptor is through calcium, and oxytocin also act through the calcium, and thyroid releasing hormone also act through the calcium. Last one, cyclic GMP. Through cyclic GMP, nitric oxide produces a vasodilatation, and atrial natriuretic peptide produces the mesangial cell relaxation and decreases the ECF volume. So option B is the correct answer. The nitric oxide is act via the cyclic GMP. So this was one of the NEET PG question. Okay. Most abundant protein in human cell is option A actin, option B tubulin, option C albumin, option D myosin. In the human cell, more than 50% of the cell part is made up of cytoskeleton. So microfilament, microtubules, intermediate filaments. That cytoskeleton mainly made up of the protein actin. So the correct answer is most abundant protein in the human cell is option A actin. This is also NEET PG question from the general physiology. A patient complained of severe watery diarrhea looking like rice cruel stool. Damage of the which structure causes this diarrhea? So watery diarrhea appearing like rice cruel stool is occurring in the cholera. So cholera affect the which structure? So option A gap junction, option B adherence junction, option C tight junction, option D hemidesmosum. So which one is the answer? We will discuss. So Vibrio cholerae is the organism for producing the cholera. This is one of the fatal disease. So it produces the sonula occludens toxin. The other name of the tight junction is the sonula occludens. So Vibrio cholerae produces the sonula occludens toxin. It damages the tight junction. Okay. So tight junction is important, mainly present in the brain, intestine, kidney. In the brain, it produces the blood-brain barrier. So intestine also it produces the epithelial barrier. That barrier is destroyed by the Vibrio cholerae. In the renal tubule also tight junction is there. So lesion in the tight junction mainly made up of two proteins, claudin and occludin. So the damage of these proteins in the renal tubules produces the congenital hypomagnesemia and hyperuricemia and nephrocalcinosis and ocular disease. So in this question, the Vibrio cholerae affect the tight junctions. The question is, the magnitude of equilibrium potential is calculated from option A Goldman equation. Goldman-Kotskin's equation helpful to determine the membrane potential if the more than one or two ions involved in the potential changes. So that is helpful by the Coleman equation. So this is not the correct answer. Gibbs-Donan effect. So it explains the diffusion of the ions in the both side of the semi-permeable membrane in the presence of the non-permeable ions. Thus Gibbs-Donan equation. So this is also not correct answer. Avogadro equation, it is gives the number of moles in units in the 1 gram of the substance. So this is not the correct answer. Correct answer is Nernst equation. So it gives the equilibrium potentials. When the concentration gradient, the electrical gradient is equal, how much amount of the equilibrium potential is seen by the formula RT ZF. RT is divided by the ZF in concentration outside and concentration inside. That formula is helpful to determine the equilibrium potential. Equilibrium potential for the fluoride is, for the nerve, minus 70 millivolt, for sodium plus 60 millivolt, for potassium minus 80 millivolts. Thank you. Thank you for watching this General Physiology MCQ video. இந்த சேனலை சப்ஸ்கிரைப் பண்ணாதவங்க சப்ஸ்கிரைப் பண்ணுங்க. இதை பார்த்து உங்களுக்கு பிடிச்சிருந்தவங்க உங்கள் ஃப்ரெண்ட்ஸுக்கு ஷேர் பண்ணுங்க. வேற காலேஜில் படிக்கிறவங்களுக்கும் அதை ஷேர் பண்ணுங்க. நன்றி, வணக்கம்.